On page HOI, this is so complicated I can't even figure it out. So we are now going to be dealing with some medications that are given for managing, it says psychiatric disorders, but these are actually very, very common behavioral and emotional problems that by and large everybody has to some degree, some just more than others. And you'll notice that among the 25 most prescribed drugs, at least as of 2009, Xanax, which you probably have heard of, we're going to talk about that, that's used for anxiety. Lexapro for depression and anxiety, Ativan, including for panic disorder, Zoloft for depression, OCD, you know, right? You know what OCD is? PTSD, post-traumatic stress disorder, PMDD. Well, in case you weren't familiar with it, that's premenstrual dysphoric disorder. Some other drugs, Zoloft, Prozac, Deserel, Cymbalta. Boy, I see a lot of commercials on TV for that. Seroquel, Effexor, Valium, and a whole bunch of others. So let's talk a little bit about these. And there's several categories of drugs that are pertinent. And on page H1, so we're going to begin with a sedative anti-anxiety drugs on page H1. These drugs, and just from the name sedative, so sedatives do what? Make you sleepy, help you sleep. So anti-anxiety, reduce anxiety. They are also known as anxiolytic drugs. Now, lytic, as we've learned with parasympatholytic and sympatholytic, means they block or reduce, right? So an anxiolytic is a drug that reduces anxiety. They're also known as minor tranquilizers. But first, before we get into the drugs themselves, what is anxiety? So we've written that anxiety is an emotional state resembling fear. Now, I wrote that there's no external cause. That's not necessarily the case. There may be a cause, but there may not be. It could just be somebody has anxiety and they don't even know why. About 5% of the population has anxiety to the point that they are being treated for it. And I wrote that it is more common in women. This is true with many behavioral and emotional disorders. However, we don't really know whether it's more common in women than men, or whether simply women are more likely to actually go to a doctor regarding that, and men are more likely to go to the bar. All right, so, but I suspect that it probably is a little bit more common in women, just physiologically than in men. It is associated, anxiety is associated with fears, worry, dread, and here's the bottom line. It's out of proportion to the actual likelihood of real problems. In other words, it's one thing if you have a lot of fear and it's warranted, but if you simply have a lot of fear and anxiety that is beyond really the probability of something else. If somebody really has a lot of anxiety about earthquakes, all right, yeah, the big one could happen. But on a day-to-day basis, what's the probability on any given day that we really have to worry about earthquakes? You know, if somebody's going around every single day, then that's kind of disproportionate to the real problem. What are some examples? So I mentioned earthquakes. So fear for health and safety. There are people who are, hypochondriacs and are worried about, they're going to get cancer or whatever it is. Anxiety about being late for appointments. Of course, there's some people who have no anxiety at all and are late. Fear of the dark. How about that one? Fear of being alone. Now, there's a whole bunch of these. What are the symptoms of anxiety? Increased muscle tension, commonly have to go to the bathroom frequently, difficulty in swallowing, exaggerated startle response, having trouble sleeping, that's called insomnia, and maybe nightmares when one does go to sleep, and trembling, sweating, nausea. Now, the original, most famous classical drug in this category of anti-anxiety drugs was Valium. Valium's still given. There are a whole bunch of others. Now, I do want to make a distinction between classic anxiety and what is known as performance anxiety. Performance anxiety is also referred to as stage fright. And stage fright is where you're anxious in performing, and your heart speeds up, and your blood pressure rises, and you're really exhibiting a sympathetic response, right? You're stressed. So this is really anxiety, performance anxiety, or stage fright is really just classic stress. But that's a little bit different than classic anxiety. And in fact, you'll notice that with stage fright, since it's really related to a sympathetic response, increased heart rate, increased blood pressure, it's treated with beta blockers. Now, the question is, when you, and all of you are becoming masters of working in the clinical setting, but certainly when you first started, you probably had some anxiety. Maybe you still have a little bit. But it may be that what you really had was stage fright more than anxiety, classic anxiety. Because stage fright, if we think of an actor who's got to go out on stage, they are understandably anxious and stressed, and they've got to go out there and perform. Well, I think in many ways you've got to go out there and perform. Let me kind of give you insight if you haven't been told this already. I remember when I first started teaching, and that was a long time ago, about 35 years ago. And I started teaching when I was 26. And I had students who were actually as old or older than I was at the time. And I kept thinking as I was lecturing, do I really know this stuff? I'm lecturing it like I'm the authority. And I kept thinking, I'm really just, I'm just faking it. I don't even know what the hell I'm doing here, standing in front of this group of students and presenting this information. And then what you actually learn, I believe, is that as a professional anything, professional teacher or dental hygienist, what starts out initially as an act eventually becomes real because you really do know it. But you don't think you know it. And so, now right now you're still learning. But some of the stuff you really do already know, some stuff you're still learning. Now eventually you'll get your first job after you're already a registered dental hygienist, and you're still going to be thinking, what the hell am I doing? I don't even know what I'm doing. But you do know what you're doing. You wouldn't have passed those exams if you didn't. And so you have to actually grow into the part of who you're pretending to be. You are an actor. And when you go in to see your patients in the clinic, you should do a really good performance. All right? Yes, this is this is exactly, and whatever you're doing, you just, and you just make it clear that you are confident and all that, and you will become confident. So, and I think that's true with everything. This is another example of this is when you have your first child, you wonder, what the hell am I doing? I have no idea what to do with a kid. And then you grow into being a parent. You just get used to, that's what I do, Do I really know what the hell I'm doing? Not really, but... So I think there's a lot of this where you kind of act the part until you actually believe it finally, that you are what you became. Anyhow, that's my thought on that. Now that we've mentioned anxiety, and there's slightly different forms of it, so the classic drug is Valium. And at the very bottom I mentioned that it wasn't until 1977 that they actually discovered where in the brain Valium is working. Valium was developed in 1963, but it wasn't until more than 10 years later that they found what they call benzodiazepine receptor sites. And the reason why they call them benzodiazepine receptor sites is because the generic name for Valium is benzodiazepine. They didn't want to call them Valium receptor sites after a brand name, so they actually call them benzodiazepine receptor sites. On the next page, and then in 1983, about 10 years later, they found that what benzodiazepine drugs like Valium do is that they enhance the inhibitory action of a neurotransmitter called GABA, gamma-aminobutyric acid. So basically, the benzodiazepine or anti-anxiety drugs like Valium enhance or promote inhibition or slowing down of activity in certain parts of the brain. Specifically, which parts of the brain? The limbic system. The limbic system we've mentioned is the center of emotions. So basically what Valium and drugs like Valium do is they depress, they slow down electrical activity in the limbic system. And they, interestingly, they create very little depression in any other part of the brain. Oh, it's primarily slowing down, inhibiting neuroactivity in the centers of emotion, the limbic system. And in that respect, in that fashion, it's believed that it reduces anxiety and other emotional issues. There are all kinds of anxiety disorders, so it's used for a lot of purposes. So Valium drugs are used for insomnia, having trouble sleeping. They're given to people after an MI, a myocardial infarction. And if you're thinking, why? Do you think that somebody who's just survived a heart attack, do you think they might have a little anxiety? Like, they might have fear that, am I going to wake up in the morning? You know, maybe I can't even go to sleep at night because I don't know if I'm going to wake up. Migraine headaches are triggered by anxiety. They are exacerbated. Asthma can be brought on by anxiety. This is classic when you have kids who have asthma or prone to it. Anytime they get anxious, they have trouble breathing, they have their asthma attack. There is psychogenic vomiting, where some people, when they get anxious and nervous, they feel nauseous. Masochistic behavior is related to anxiety. And there's all kinds of masochistic behavior ranging from something that's not too bad, like, nail biting and stuff, which becomes kind of just habit forming, to pulling hair out, or then it can be more dangerous in terms of jamming things into one's skin and so on, and actually causing injury. Ulcers can be exacerbated by anxiety. They're not necessarily the cause, but they can be made worse. Certainly giving birth, it causes anxiety. And many patients experience dental anxiety. They go into, the very thought of going to the dental office will cause them to be anxious for weeks before the actual appointment. All right, so the anxiety is disproportionate to the real problem, but there are people who just feel that way about dentistry and dental offices. Let me just also make a comment. I began by saying that all of these behavioral and emotional issues, we all have these. And it only becomes a problem if two things happen. If either your problem, if you have any of these things, if you're not happy with the way you are, it's a problem. All right? If you're okay with it, then it's not a problem. But it may also be a problem, even if you're okay with it, if the people around you are not okay with it. So if you're okay with whatever you're doing and the people around you are okay with what you're doing, then it's not really a problem. But if either you're not happy with it or the people immediately around you, family or close friends, they're not happy with it, then it is a problem. Valium-type drugs are also used in the treatment of mild depression, including panic disorders, and they are also used to reduce anxiety, calm people down, help them sleep, either before surgery or even after surgery, so preoperative sedation. Before the Valium-like drugs, before they were developed, the drugs they used to use before Valium were barbiturate sedatives. Barbiturate sedatives are like phenobarbital and thiopental, the barbiturate sedatives, and Valium drugs have a much greater margin of safety or therapeutic index. And I'll remind you what therapeutic index or margin of safety is. That's the difference between the LD50 and the ED50. So the Valium-like drugs have a much bigger margin of safety difference between the therapeutic dose and the lethal or harmful dose than do barbiturate sedatives. Barbiturate sedatives, the dose that you use for helping you sleep, and the dose that can be fatal is a much smaller difference. The Valium-like drugs have less drug-drug interaction and are less likely to cause physical dependency than our barbiturate sedatives. The Valium-like drugs are also used as centrally acting muscle relaxants. By acting on the brain, in the limbic system and some other areas of the brain, they help decrease nerve impulses to the skeletal muscle. And by reducing the neural impulses out to the skeletal muscle, it allows the muscles to be more relaxed. Why would you want to give a drug that does that? This is given to people who have muscle spasms, and the muscle spasms probably are either caused or exacerbated by increased nerve impulses from the brain out to the skeletal muscle. It's used for people with tetanus or lockjaw. And how lockjaw or tetanus got its name is because this bacterial infection, Clostridium tetani, produces a exotoxin that affects the brain, and it increases nerve impulses to the skeletal muscle, including those in the face. And that's how it got that nickname, lockjaw. So it's also been used to reduce spasticity in people with cerebral palsy. So cerebral palsy, we probably have all seen people with cerebral palsy, which is complete this thought. You know, they're all commonly in wheelchairs, and they kind of have this spasticity and difficulty in moving their muscles, and they can give Valium-like drugs to reduce the spasticity. The Valium-like drugs are also used as anti-epileptic and anticonvulsant drugs, and very importantly, Valium is still one of the most important drugs given to people undergoing drug withdrawal. So when you hear about the Betty Ford Clinic in Palm Springs, so whether they're undergoing a withdrawal from alcohol or from cocaine or from whatever, they do usually give them Valium or Valium-like drugs to help them get through withdrawal. And it just reduces the pain and the anxiety of going through what's called abstinence syndrome. On page H3, the Valium-like drugs, which obviously act on the brain, accumulate in fat tissues. Do we understand why? We have learned that any drug that affects the brain must be very fat soluble to get across the blood-brain barrier. So we had said all psychoactive drugs, all drugs that affect the brain, also because they're so lipid soluble, tend to ultimately accumulate in fat tissue. I'm just reminding you of that. Adverse effects, they do cause drowsiness and fatigue, lethargy, ataxia. Everybody know what ataxia means? Loss of coordination. So they make somebody less coordinated. Decreased coordination of the skeletal muscles because it's affecting the brain, it's sending nerve impulses out to the skeletal muscle. And the Valium-like drugs have atropine-like effects. And that's actually the way the drug books describe it, atropine-like effects. I said earlier today, you should know epinephrine, you should know atropine. Atropine is a parasympatholytic. It blocks the parasympathetic response. It blocks the muscarinic acetylcholine receptor sites. And so if you block the rest and digest parasympathetic response, if the parasympathetic response is increased salivating, Blocking rest and digest means decreased salivation or xerostomia. If the parasympathetic rest and digest is increased GI motility, blocking the parasympathetic, which is what atropine does, decreases GI motility or causes constipation. It's also has that effect on the brain that it tends to cause drowsiness and so on. Cautions, Valium should be used with caution in somebody who drinks alcohol, who takes other sedatives or CNS depressants, or takes antihistamines, because antihistamines cause CNS depression. So just imagine if somebody is taking a Valium-like drug for anxiety, which causes CNS depression of the brain, and then they've got a cold, so they take an antihistamine, and then they have a glass of wine, so these start to get additive, and then they may go into a coma, because they've got too many things slowing down electrical activity in their brain. And that's what happens when people take a sleeping pill and then alcohol on top of that, or an antihistamine, and then they just don't wake up. Now the Valium and Valium-like drugs are Schedule 4 controlled substances. That's one of the lower categories. So Schedule 4 does not require a tamper-resistant prescription form. You can use any prescription form, but the prescriber does have to have their DEA number on there. It is a controlled substance. So the NARCs, the Drug Enforcement Administration, does monitor Valium and Valium-like drugs, but they're not as worried about dependency and abuse with Valium as they would be with morphine or amphetamines, speed, and so on. There are a whole bunch of other Valium-like drugs. Valium was, I call it that because that's the prototypical first example. Xanax is a commonly used one for, again, anxiety and panic attacks. Buspar, you may have heard of. Ativan, Serax, Restoril, Halcyon, and one that I think everybody has heard of is Ambien. And Ambien is taken to reduce anxiety and help people sleep, like on long airplane flights. Another one that I see a lot of commercials for is Lunesta. Right? So again, these are, what are they, all of these for? To reduce anxiety and help you sleep. On H4, just a bunch of others. Now, there are a few other related drugs that are related to this category of drug. There's a drug called Klonopin. Again, I'm not asking you to know names of drugs. That is very commonly used to treat certain types of epilepsy. So Valium itself can be used to treat epilepsy. And we had mentioned Valium and these kinds of drugs are used to reduce, to cause muscle relaxation by reducing the sending of nerve impulses from the brain out to the skeletal muscle. So they are used as centrally acting muscle relaxants, including for the treatment of TMJ, where some people have chronic spasticity or increased muscle tension in their jaw. These go under brand names like Soma and Rela. Flexeril. Has anybody ever heard of Flexeril? And another drug that's related is Neurontin. We'll tell you more about Neurontin when we get to anti-epileptic and anti-seizure drugs, Neurontin. And another one, the drug I listed at the very bottom is a little bit different. This is not a drug that activates the benzodiazepine receptor sites, which is what Valium does. This is a drug that blocks the benzodiazepine receptor sites. It's called Mazicon. And that's what's given if somebody takes an overdose of a Valium drug. So Valium activates the benzodiazepine receptor sites in the limbic system. And this is a drug that blocks these benzodiazepine receptor sites. Maybe what will help is take a look at page H7. H7. And on page H7, this picture on H7 reminds us of where the limbic system is. And you'll notice that the Valium receptors are located right here in the limbic system. So what are called Valium receptors are more properly called benzodiazepine receptors. And again, how did they get that name benzodiazepine? That's the generic name for Valium. So the Valium or benzodiazepine receptors are in that part of the limbic system. Incidentally, you'll notice that this area of the brain is where the opium receptor sites are. We'll talk more about that. And this is where the dopamine receptor sites are, and the opium receptor sites are here. So the opiate receptor sites are here, the dopamine receptor sites are here, and the Valium or benzodiazepine receptor sites are here. So obviously narcotic drugs affect the limbic system, the center of emotion. The Valium-like drugs affect the limbic system or center of emotion, and dopamine-type drugs can affect the limbic system. Also, if you take a look at page H8, you'll notice on H8, so this shows Valium right here, and just to compare it with phenobarbital. So phenobarbital was a barbiturate sedative, and that's what they used to use to help people sleep and reduce anxiety, is drugs like phenobarbital. Valium is what they use more commonly today. Look at the therapeutic index. The therapeutic index for Valium is 20, almost 21. The therapeutic index for phenobarbital is 2. You'd say, what does that mean again? That's the ratio between the LD50 and the ED50, meaning if you give 2 times the therapeutic dose of a barbiturate sedative, you kill people. To kill somebody with Valium, you'd have to give them 20 times. Now again, it's not like anybody's going to be giving them too much, but what if they decided to take the pills? They said, I'm going to kill myself. They'd have to take a lot of Valium to kill themselves, but it doesn't take a lot of barbiturate sedatives, right, in their little container of pills. So that's what we mean by Valium having a much wider margin of safety. That takes us to page H5, and on H5, they sometimes even use antihistamines as sedative anti-anxiety drugs. After all, we know that a side effect of most antihistamines is they make you drowsy. They cause sedation. So if somebody is feeling anxiety and they have insomnia and it's hard for them to sleep, they may give them basically an antihistamine. And so just know that they can be given for that purpose. You don't have to know the name of a drug. I'm given one, hydroxyzine. And this one especially is used to reduce anxiety. Especially it's commonly used in children. They'll use this drug as opposed to some of the others. All right. I'm just going to briefly remind you of what the barbiturate sedatives are. The original class of prescribed drugs that were given to people to help them sleep were called barbiturate sedatives. A sedative helps you sleep. It causes sedation. The Valium drugs have replaced them largely because they are considered safer and less addicting. So that's all that I want you to understand, is that if you run across that term, barbiturate sedatives, these are just an older category of drugs that help people sleep. I do want you to know something, though, that I wrote on H6. On H6, I do want you to know this sequence right here. Anytime, in general, anytime somebody starts to take a CNS depressant, What's a CNS depressant? A drug that slows down electrical activity in the brain. As they take more and more of the drug, this is the sequence of what happens to their brain. First, a CNS depressant causes sedation. What's sedation? Drowsiness. Then it causes hypnosis. Now, the moment that most of us see that word hypnosis, we're thinking, yes, master, what should I do? No, we don't mean being hypnotized. Hypnosis is a clinical word for sleep. So the clinical word for sleep is hypnosis. So as you increase the dose, you go from drowsiness to sleep. And then as somebody takes any CNS depressant, any, quote, sleeping pill, and they start to take more and more of it, it causes depression of the respiratory center. And the respiratory center is the control center that controls breathing in our brainstem, in the medulla oblongata. And then the person goes into an unconscious state, and then they go into a state of general anesthesia. If time permitting, we'll remind you of the stages and planes of anesthesia, which I know you were introduced to when you covered nitrous oxide. But basically, here's the point. You cannot be in a state of anesthesia without first causing respiratory depression. So that's why, even when you're giving nitrous oxide, trying to reach that stage 1, plane 2 of anesthesia, the person already has a depressed respiratory function. As you increase the dose more, then you go into a comatose state. So you should understand that anytime somebody's taking drugs that depress the central nervous system, and this includes general anesthetics, it includes sleeping pills, it includes narcotic pain relievers, they all can depress the central nervous system and lead to this sequence. So I do want you to know that. And that takes us to page I-1, page I-1. Psychoneurotic drugs. And as we mentioned last time from the name, psychoneurotic, we're thinking, oh boy, this must be the category, this must be for real wackos, whack jobs. No, in fact, psychoneurotic disorders are the most common of all disorders, behavioral disorders, and we all have psychoneuroses. Aren't you pleased to hear that? These include panic attacks. And there are many people who have suffered panic attacks. These are related to post-traumatic stress disorders, or PTSD. I'm sure you've run across that, post-traumatic stress disorders. You're going to see that at the VA hospital, certainly. And this could be as a result of combat. It could be as a result of being assaulted. Some people have it from earthquakes. Just the very a panic attack. If we get a little tiny shake, then it's the end of the world. Okay. We're going to see that these panic attacks are treated with a class of drugs called the SSRIs. We'll talk about them, the selective serotonin reuptake inhibitors. We'll see that written in a moment. Prozac was the first in this class of drugs. Furthermore, even more common than panic attacks are phobias. These are the most common of all mental disorders. These include, and probably some of you, including me, experience these. Fear of flying. I don't have to have that. But agoraphobia. Agoraphobia means fear of open spaces, being out in crowds. Fear of heights is very common. Very common is fear of public speaking. How about this one? Fear of getting an injection. I think that's somewhat common. All right. Fear of seeing blood. And fear of animals. And not only are a lot of people fearful of spiders and snakes, there are many people who are fearful of dogs. You probably, it could be you or you may know people. Just they see a dog, they try to avoid it. So these are very, very common. But and these again are treated with Prozac type of drugs. OCD, obsessive compulsive disorders. These tend to be common among dental hygienists. I think it's in part the person who goes into dental hygiene and also your training. You're trained to be a little bit OCD, right? You got to check all the details. So, but something that you may find interesting is, what's the difference between an obsession and a compulsion? Well, the cute answer is an obsession is a brand name for a perfume. No, all right. The difference between an obsession and a compulsion, an obsession is a thought, a recurring thought that you can't get out of your mind. A compulsion is a recurring thing you do. So if you have thoughts that keep, or feelings that keep, and again, all of us have these things. A compulsion is something that you feel compelled to do. So it's not your thinking, but something you're doing. I'll give you some examples of that in a moment. 2 to 3% of the US population is being treated for OCD, and half of them are depressed, which is understandable. What are some examples of compulsions? So cleaning, like hand washing, checking to see if the lights are off. I'll give you an example of one compulsion I have. Whenever I take my family on a vacation, so like it's a car trip, right? So we've locked up the whole house, and I'm in the car, and I start to pull out of the driveway, and I think I left the lights on, and I go and check the light. No, the lights are off. And I get in the car, okay, and I start to put, I think I left the air conditioning on, or whatever it is. And I go back and check. I have to do that a few times before my family throws things at me. And they said, let's just leave. The eating disorders, anorexia, bulimia, these are compulsions. Sexual compulsive behavior, compulsive gambling, kleptomania, that's what? Stealing, hair pulling. Compulsive shopping, my wife has that. Pyromania, which is wanting to play with fires, right, and matches and so on. So these are not rare. They are actually very common, and we all have them. And they are also treated with this newer class of drugs called SSRIs, of which Prozac was the first. Whether you need treatment for these problems or not really depends upon how much these problems bother you, or they bother the people around you. If you're not bothered by it, and the people around you are not bothered by it, it's not really a problem. But if somebody does have some OCD issue, where it literally makes them feel that there's something wrong, or they've got a phobia, a fear, or panic attacks where they're not happy with the way they are, that's when you want to go and do something about it. But we all have these things to varying degrees. Okay, on page I2, so the prototype, the classic example of this class of drugs is Prozac. That's the brand name. Its generic or official name was fluoxetine. The other names for, well, the most common name for these is the selective serotonin reuptake inhibitors. And yes, I do want you to know that, because we're asking you to know classes of drugs. And when you look up these drugs, you will see them referred to as SSRIs. They're also known as the heterocyclic antidepressants, but we'll call them the SSRIs. The number of people taking them has been skyrocketing. In 1988, not too many years after they were introduced, 2.5 million prescriptions were written for it. In 1992, it had increased to 9.6 million. I don't know the most current information, but I'm sure it's way beyond that. How do these drugs work? Well, the reason why they're called selective serotonin reuptake inhibitors is they inhibit the reuptake of serotonin, increasing the availability of serotonin in the brain. And if you're trying to visualize what it is I'm saying, if this is a neuron right here, and here's its synaptic knobs, and this neuron, when it sends an action potential down its length, it releases the neurotransmitter serotonin. And this serotonin acts on other neurons in the brain. Now, normally after a neurotransmitter is released, one of two things happens normally after a neurotransmitter is released. Either the neurotransmitter is broken apart by an enzyme, And that's what happens in the case of acetylcholine. It's broken down by acetylcholinesterase. That's what happens with catecholamine neurotransmitters like norepinephrine. They're broken down by MAO, monoamine oxidase. But in the case of serotonin, it's not that there's an enzyme that breaks it down. It's normally retransported. The serotonin that's released is normally transported right back into the synaptic knob. And so that's called reuptake. So what these drugs do is they inhibit the reuptake. So if the serotonin that was released isn't being pumped back into the knobs, that means it continues to exert its effects on the brain. So it basically prolongs the action of serotonin on the brain. Serotonin, as we wrote here, generally inhibits sensory pathways, although serotonin excites motor pathways. And while it's good to know both of those two statements, the more important one is that it normally inhibits sensory pathways. So it's believed that one of the possible benefits of SSRI drugs like Prozac is that by causing serotonin to exert its action to a greater extent than normal, it's inhibiting neural processing in the brain. My simplified take on what Prozac does, let's say for somebody with an OCD. All right, so somebody who's got an obsessive compulsive disorder, let's say they just have to keep washing their hands. And so they've got a neural circuit. And once that circuit begins and they wash their hands, they just can't break themselves out of this neural circuit. It just keeps activating a series of neurons, causing them to keep washing, and they're ready to dry their hands, and then they got to keep washing them again. And what this does is it basically allows inhibition of some parts of the brain that makes it a little bit easier to break themselves out of that kind of neural pattern, that behavioral pattern. That's kind of my take is, but again, nobody fully understands these drugs. Another class of drugs that I'm going to be mentioning after this one are the tricyclic antidepressants. And the Prozac drugs, the SSRIs, are considered to have some advantages over this older group of tricyclic antidepressants. They improve self-confidence, they have fewer side effects, they're safer, and some of them you only have to take once a day, unlike the tricyclic antidepressants. The SSRI drugs, like Prozac, are used for these very common psychoneurotic disorders, OCD, panic attacks, phobias, so that's their main uses. Although they, as we'll see, they can be used also for depression. The main adverse effects are, they can cause some degree of insomnia, but the important one for you is xerostomia. Almost all of these drugs that affect the brain do have the side effect of causing dry mouth for various reasons. Some of them can even have some side effects of causing suicidal thoughts. So that's what, sometimes when you see ads for these products, they'll mention that. These are usually rare, but they can happen. And let's see, I think that's the main thing I want you to know. Prozac was the original drug in this category on page I3. Today, there are a whole bunch of other SSRI drugs, and these include Celexa, Paxil, Zoloft, and these last three, Effexor, Cymbalta, and Cerzone, and yes, I mentioned Cymbalta actually as an anti-anxiety drug last time. These are actually known as, they are known as SNRIs, or selective serotonin and norepinephrine reuptake inhibitors. So these inhibit selective serotonin reuptake inhibitors. These inhibit the reuptake of serotonin, increasing the action of serotonin. These last three increase the action of both serotonin and norepinephrine. So I'm not asking you to know that distinction, but they will call these SSRIs and these SNRIs, serotonin norepinephrine reuptake inhibitors. So you'll see that written. But we're just viewing them as one similar class of medication.